Hi, my name is Carl Freeman. I'm a nursing student at Miles Community College. Today I will be demonstrating how to place an IV solution. So the first steps is to remember the 6 rights of medication administration. You have right patient, right drug, right route, right dose, right time, and right documentation. Second step here is hand hygiene, so we'll wash our hands. We're going to place gloves. All right. Next, we're going to go through the physician orders and the MAR to make sure everything's correct. So we have Mr. IV Needed, who's been diagnosed with bronchial pneumonia. He's allergic to penicillin and latex. And we have his medication number. So we will compare that with the MAR, and everything matches. We're going to sign and date it. Okay, next step here is to ask the patient, or we're going to select our solution. So we have 1,000 milliliters of 0.9% sodium chloride. We're going to check the expiration date, which we're good there. And we're going to check for any breaks in the bag. I'm going to place our bag on our makeshift stand here. Okay, next step is to place we're going to ask him 2 patient identifiers, and Mr. Needed will give us his name and date of birth, which we're going to compare with on the medical record, which matches. Next, we're going to place the bed at a comfortable height for the nurse, which, since this is a table, I'm just going to sit down. We're going to get our tubing. We're going to check our tubing for any kinks. And it looks like we're good there. And we're going to set up our IV. So first I'm going to get some alcohol. I'm going to pull the cap off of the bag. I'm going to clean with alcohol just to be extra safe. We're going to pull the cap off the spike, and without touching the spike, we're going to go directly into the bag. And we're going to prime this to be 1/3 to 1/2 full. We're good there. We want to make sure this doesn't touch the ground and contaminate it. So next I'm going to set up my drop factor. And so we look at the doctor's order here. We have 0.9% normal saline, 1,000 milliliters to infuse over 6 hours. Our drop factor is 10. We're going to need 166.7 milliliters an hour. And the drops per minute will be 27.8. So that'll be close to 7 drops per 15 seconds. So I'm going to look at a clock. I'm going to wait for the right time here. Sorry. Okay, there we are there. We're gonna lock it. Okay. Next, we're gonna go over here and Mr. Needed is gonna give us his name and date of birth. We verified that. We're gonna start by cleaning the arm. We're gonna get another alcohol pad. We're going to apply a tourniquet approximately 6 inches above the site of insertion. Next, we're going to grab our needle. We're going to palpate the arm to make sure that we have the tourniquet in place. We would trim the hair if it was necessary, but it's not necessary in this situation. We've cleaned and let dry. We have the catheter. We're going to, with our non-dominant hand, we're going to pull down on the skin below the site, and at a 10 to 30 degree angle, we're going to pierce the skin. Okay. Our next step is to remove the tourniquet. After we advance the catheter in place, we're going to place a piece of tape in the shape of a chevron. Let's see here. We're going to place a gauze pad under the site of insertion. We're going to do this without irritating the patient's arm here. We're going to take our Sure Sight transparent catheter dressing. We're going to write the gauge of the needle, the initials of the nurse, and the date that we applied it. And we're going to try not to mess that up too much. And I did, so we're going to try that again. So, date, initials, gauge number. We're actually going to put in our clear link lure lock. We're going to remove. We're going to check to make sure that the needle is still there and nothing's wrong with and then we're going to place it in a sharps container. At this point, we have blood coming, so we're going to be sure to be quick and apply the lock. We're going to place a piece of tape over. We are going to then apply our transparent dressing. That will help keep our IV patent. We're going to remove our band here. Okay. Next step is we're going to attach the tube to the arm. First, I need to clean the saline lock with an alcohol pad. Reduce the transmission of microorganisms. We're going to insert I'm going to come over to our safety lock and we're going to remove that so that the IV can spread. Next we're going to dispose of our trash appropriately. Needle has been put in the sharps container. And next we're going to lower the bed so the patient is in a safe position, and we are going to document. So we're going to come over to the MAR. We're going to document the type of saline, the equipment we used, how the patient dealt with the procedure, and that's it.